Okay, this is your lab prep for posterior triangle of the neck lab. This is really more like superficial neck, I guess, because we will be sort of overlapping between posterior and anterior triangles. But in any case, we're going to start in the neck region. You'll want to loosen the head bags. You can cut through the string that's tied around the bag and relax the bag, and you can pull it up to the line of the mandible. We don't want to expose the face yet. That's not necessary. But we do need full access to the neck, both anterior, lateral, and posterior. So get the bag to sort of come up to about here, and then we'll be good to go. So we're going to start by removing the skin from the whole anterior and lateral neck. Posterior should have already been done. And I would suggest the best way to do that would be to start with a midline cut and reflect from the midline and go out laterally. There's not much in the midline that you could damage, so that's a great place to start. This is very thin skin removal, different than all the other skin removal you've done so far. So if you're concerned at all, I would suggest leave all of the fat down and just remove the epidermis and the dermis layer, and leave all of the fat down on the tissue, and we'll be able to work through that. There's usually not that much fat in the neck, so or at least in the superficial neck, so this is a proceed with caution step. Okay, so once you get the fat or with the skin removed, we may have to do a little bit of cleanup in terms of fat removal, but the first structure we're going to be looking for is a very thin muscle called the platysma. It's nowhere near this big or this robust or obvious. It has this orientation, flaring off to the side from the angle of the mandible, but it's definitely not this robust. I've done this a lot of times and I've never seen it look that good. But platysma, it's so named because it's flat, and it is a muscle of facial expression that we'll learn more about later in the course. Once this is identified, we need to reflect this superiorly. Probably the easiest place to start is not from the bottom and work your way up, but to rather work from this edge, because this edge is going to be the most easy thing to see. And if you can get a scissor underneath there and start pushing tissues apart, you'll be able to get this to reflect as a sheet. Once you get the platysma out of the way, then we'll actually be able to observe the posterior triangle anatomically. These are its three borders: trapezius, sternocleidomastoid, and clavicle. So get those structures identified right away. We need those landmarks to be clear. And then we want to take a look at some of the structures that are lying on the surface of the sternocleidomastoid. And this is a good reason to exercise caution when you're reflecting the platysma, because especially this vein, the external jugular, has a tendency to want to stick to the back of the platysma when you reflect it. So go easy when you're reflecting platysma, and keep an eye open for a vein that might be sandwiched between it and the sternocleidomastoid. So in addition to the external jugular vein, which will be seen on the lateral or superficial surface of SCM, the internal jugular vein will be seen, and it's quite large by comparison, and it will be deep to the sternocleidomastoid. You may be able to see that already today without getting anywhere into the fascia of this carotid triangle here. So observe your veins. If you've got an external jugular vein, that's great. If you follow it up superiorly, eventually this turns into the retromandibular vein. So have a look and see if that happens in yours. The next thing that we're going to do is look for the specific branches of the cervical plexus that we're going to do today. Most of what we're going to do today are sensory branches of the cervical plexus, and three of them have particular relationships to the sternocleidomastoid. These three nerves here, lesser occipital nerve, great auricular nerve, and the transverse cervical nerve, all come from the cervical plexus, and they are sensory branches that are responsible for innervating the skin. And they all emerge from about the same spot, right behind sternocleidomastoid. This is called the nerve point of the neck. And these three sensory branches, as well as there's another one down here that we'll get to in a second, all emerge from this place, and they're responsible for sensation over the whole anterior and posterior triangle regions. So pretty important. In addition, the great auricular comes up onto the face to supply the ear and a little bit around the angle of the mandible. So this isn't the last time we're going to see these nerves in our exploration of the head and neck. But have a look. They're usually pretty thin. Great auricular is probably the biggest. It's usually parallel with the external jugular vein, and often quite close, closer than is represented here. You'll see those two near each other. So have a look for these. These two will be easier than this one. You'll have to almost get behind and underneath the sternocleidomastoid in order to get to lesser occipital. All right, the last branch of the cervical plexus we'll see today is the supraclavicular nerve. There's usually several of these that are running, instead of this direction across the sternocleidomastoid, they're coming from the same place, but they're running down out towards the clavicle. And these should, this space is usually filled with fat in here, and if you work through this fat, you'll be able to find these nerves relatively simply. The last nerve we're going to find today is not a branch of the cervical plexus at all. You've seen this before. This is the spinal accessory nerve, cranial nerve 11. We found it before on the deep surface of trapezius, so we're kind of just working our way backwards, and now we're finding it right before it got to the trapezius. And you'll usually find this one in this sort of orientation, coming from deep to the sternocleidomastoid and progressing downward deep to the trapezius. This nerve innervates both of those two muscles, so this is a good visual reminder of that. Okay, so that's about all we're going to do with the posterior triangle today. Then I'll have you turn to the anterior triangle, and we're going to do some real basic laryngeal skeleton and muscular anatomy associated with the larynx. So we've got the hyoid bone. It won't be this easily visible, but you'll definitely be able to feel it. You can palpate your own if you need any sort of comparison. The thyroid cartilage, which should be pretty easy to see, it has the laryngeal prominence or Adam's apple. The cricoid cartilage, which is just below that, and then a soft membrane in between the two. So if you use your fingers and sort of palpate these cartilaginous landmarks and then the hyoid bone, feel for the soft spot between the thyroid cartilage and the cricoid cartilage, and that'll be your cricothyroid membrane. Once you have these landmarks identified, the muscles are a snap. The first two muscles we'll identify come off of the hyoid bone, so they have hyoid in the name, omohyoid and sternohyoid. Sternohyoid, as its name suggests, goes straight down to attach to the sternum, and it's paired right in the midline. Omohyoid is a little different. The word omo means shoulder. So this muscle actually goes underneath the sternocleidomastoid, and that's as far as we're going to see it today. But just for your information, omohyoid continues on, and it actually has an inferior belly, which progresses down deep into the posterior triangle and actually attaches on the scapula right near that suprascapular notch that we saw earlier from the backside. So omohyoid's kind of an odd muscle. Both of these muscles will be helpful to depress the hyoid, which I think is clear to look at them. You'll probably want to either reflect or move those two muscles out of the way in order to see the deeper muscles. There's one called thyrohyoid, which goes from the thyroid cartilage to the hyoid bone. That name is evident. And one from the thyroid cartilage down to the sternum, which is called sternothyroid. The other muscle that's in this area is sort of functionally a different story completely from all of these, but we're going to identify it since we're here. This muscle is called cricothyroid. It goes from the cricoid cartilage to the thyroid cartilage. It's really small. It just looks like a little fan that's connecting the two. So these muscles are all thyro, hyo, sterno, omo, crico, something. It can be a little bit of a challenge verbally to get these words straight. So you take your time going through these slowly and get to the point where you feel like it's pretty easy. But the key to doing that is really making sure you can identify these laryngeal landmarks. All right, that's it. This is going to be kind of a short lab, I think. So good luck.